Hello everyone, I'm Dr. Shivani, an MD dermatologist here at SciAmed, Gurgaon. I'm heading the dermatology department here and we take care of cases of clinical dermatology, cosmetology, trichology as well as regenerative medicine here. We'll be talking about PRP today. PRP, also known as platelet-rich plasma, is a very common procedure done for regeneration and rejuvenation. It can be done for cases of hair loss as well as facial rejuvenation. So, the patient's own blood is extracted and it is centrifuged in a process where only the platelets are removed from the blood. So, these platelets, along with these platelets, there are various growth factors that are injected into the affected area. So the platelets that are derived from the centrifugation process contains a lot of growth factors that when injected into the dermal papilla where the hair follicle is present stimulates the hair growth. So it leads to thicker and better hair quality. So PRP is indicated for patients of hair loss, patients of hair thinning, patients of androgenetic alopecia, patients who are looking for facial rejuvenation, patients of scar, patients of periorbital hyperpigmentation, patients of melasma, patients who are looking for improved skin quality. So PRP is a magic potion that contains a lot of growth factors which are derived from the platelets and which when injected into the affected area gives a lot of regeneration and rejuvenation. So PRP is extracted by the patient's own blood. We take the patient's blood and then centrifuge it for some minutes and just extract the platelets from the blood, and then the extracted platelets are injected into the affected area. So PRP can be safely done every 4 weeks.